Hello everyone. Today we're going to talk about safety in the fire service. We're not going to hit the entire chapter from IF's the 7th edition, but we are going to hit a few key points. So our first learning objective we're going to discuss and talk about is we'll talk about fire and life safety initiatives that are aimed at reducing not only firefighter illnesses, but injury and also death. As you guys know, at this point, 50% of the firefighter fatalities are due to stress in a cardiac event, and the sudden death or the cardiac arrest event. And this is in the result or direct result of overexertion, poor health habits, and we add into the occupational stress of the job. So as firefighters also injured and killed, most often it is in motor vehicle accidents, either responding to a scene or returning from. And a lower portion of that statistic is the result of emergency and on-scene deaths. Some of the information sources that we get our tracking and our statistics from, one is the NFPA, which we are used to, kind of the standard for the fire service in standards and regulations, and the other is the United States Fire Administration, and they get together with the National Fallen Firefighters Foundation, and they come together to deliver programs, and their goals is to reduce the injury and death in the fire service. Also, we have the National Institute for Occupational Health and Safety, known as NIOSH. This component and source is an investigative component that looks at line of duty deaths in great detail. They investigate each occurrence, and then they offer up recommendations to firefighters on how to reduce or eliminate what actually happened. And this also becomes published and is accessible by firefighters across the United States to study on, to train on, these case studies, if you will, and in turn learn to reduce the line of duty deaths. We also have Occupational Safety and Health Administration, or known as OSHA, that does regulate how safety and wellness and injuries in the fire service, how they occur, and again the steps that we can take to prevent those. And they also have the power to levy fines and other punishments accordingly. The National Near Miss Reporting System simply reports near misses, accidents or near accidents that happen, that get reported. And again, this component is to be used to reduce accidents, injuries, and line of duty deaths. And then we have the National Institute of Standards and Technology. This one not always directly related towards the fire service, but has done a lot of testing over the years that include the fire service, and they do a very accurate series of testing, whether it be flashover, whether it be roof collapse, building collapse, floor collapse. They build all of these models up and they burn them and record times of how long does it take to reach point A to point B and those kind of things. And so they've been very instrumental, and were instrumental in the Governor's Island project, where we learned some of our newer flow path information and the fact that we can drastically reduce temperatures in certain cases by using the slicers method. So we'll talk just a little more in depth about the National Fallen Firefighters Foundation. I'm well familiar with this group. I work for this group each year at the National Fallen Firefighters Memorial. The foundation takes care of the funding for the memorial and pretty much everything that has to do with in and around the memorial. And the mission of the National Fallen Firefighters Foundation is to honor and remember our American fallen fire heroes, and also to provide resources to assist their survivors and families in rebuilding their lives and help within the fire service community to then reduce firefighter deaths and injuries. The foundation is responsible for putting together the Everybody Goes Home program that you may have heard of or seen over the years. The foundation put together 16 firefighter life safety initiatives, and we'll go over these. The goal is to provide the fire service basically with a blueprint for making changes that will ultimately equal a lower line of duty death. The numbers a year is what we're wanting to lower, and I think over the past few years we successfully have done that. There a few years that we add, such as 9/11, and we add bigger numbers with the wildland, the wildland fire that killed 19. We get into some bigger numbers in those years, but progressively we have reduced that number to over 100 down to, I think now we're even in the 80s mark, which is, it's below the goal that the foundation had set forth a few years ago, but I think we're getting there. And the foundation is to work to establish training on fire life safety initiatives throughout the fire service in the United States. The big program where these 16 initiatives come into play is the Everybody Goes Home program. So those 16 initiatives are as follows, and it's worth spending some time to discuss because of the nature of our job, and we through the NIOSH reports and the investigations that have been done over the past 20 years or so, we have learned that these 16 things put in play can reduce the deaths and injury. So first off, we define and advocate the need for a cultural change that relates to safety, that we incorporate leadership into this and management, supervision, accountability, and just the personal responsibility of being safe. It's one thing to say be safe or be smart, as a lot of us call it, um, because we know that firefighting is inherently a dangerous job. And so we feel like that every component that we train in, we always have an added amount of safety. And with that, we're always thinking safety. But the truth is, we're not always thinking safety like we should. And so that starts us off with the number one initiative. The second one is to enhance personal and organizational accountability for health and safety. We talk about accountability on the fire ground all the time. And when we look at these case studies, we do see common themes where accountability and incident command system wasn't in play and all these things. But when we say accountability for this second initiative, we're talking about health and safety. And what we mean is on the wellness side of things. Basically, we are talking about health and wellness, everything from how we exercise to how we diet to the things that we're doing or not doing in everyday life that would contribute to our overall safety on the job. Our third initiative is the focus greater attention on integration of risk management with incident management at all levels, including the strategic, the tactical, and the planning responsibilities. Management with incident command at all levels was key words here, and we want to include this in all of our aspects of greater attention to the risk management. Oftentimes when we think of risk management, we're talking about on the fire scene when we use Brudicini's old saying as risk a lot to save a lot, risk little to save little, and risk none to save nothing. And I think we can take that a step further in all the way back to even our strategic and tactical goals. Number 4 on the list, all firefighters must be empowered to stop unsafe practices. Over the years, teaching safety or safety components in just about every part of the fire service, and in hearing that from instructors that I've had over the years, everybody always says everyone on the fire ground is a safety officer. And so with that, we need to train our rookies, our recruits, and our new people. Don't be afraid to stop an unsafe act no matter who's doing it. And I think several years ago, there was a culture in the fire service that people were afraid to say anything to a well-seasoned person or maybe even a fire chief that was doing something wrong. And And it's a culture that when it comes to safety, we've got to change, and we've got to let our folks know that it's okay to say when something's unsafe. And if somebody doesn't like it, you know, we'll sit and talk about it. We'll work it out later. The fifth thing is develop and implement national standards for training, for qualifications and certifications that would include regular recertifications that all equally applicable to all the firefighters based on the duties that they're expected to perform. So a lot of these things are in play through the curriculum, through IFSTA, through the National Fire Protection Association and the NFPA standards that are in play. And certainly these are guidelines that we should be following. And I think creating that culture to, especially with our leadership in the fire service across the United States, is to empower them to create that culture of following these guidelines and following these standards, if you will. We talk about, or they talk about, including regular recertifications. We have Pro Board and IFSAC certification programs that gives an initial certification that basically you have proved that you can do the skills safely and effectively. You've tested out on these. You've passed the written exams over the didactic material, and it says that you are good to go. I do look for recertification processes to become more and more regular. And you think about it, some things we're already doing that, such as driver's training once a year that we recertify on, emergency medical technician or paramedic that we are recertifying on every couple years. Number 6 in our initiatives is develop and implement national medical and physical fitness standards that are equally applicable to all firefighters based on the duties that they are expected to perform. This is something that we are seeing more and more studies on. We're seeing there's more programs that are becoming available. Some fire departments have developed and used their own programs. Some fire departments are encouraging their employees to seek out programs, whether they bring in dietitians to help us with our cooking and our diets, to regular wellness or annual physical and checkups that we're getting each year that are catching a lot of things. Number 7 on our list is create a national research agenda and data collection system that relates to the initiative. So the National Fallen Firefighters Foundation is doing this. They are working on collecting the data, keeping this up and running, and the data that they're collecting are relative to the 16 initiatives that they have come up with. Number 8 is utilize available technology wherever it can produce higher levels of health and safety. And certainly today we have a lot of technology available to us that we can use. There's apps for just about everything. We can communicate freely across the internet. We can communicate freely with our cell phones and smart devices. Number 9, thoroughly investigate all firefighter fatalities, injuries, and near misses. They add in here near misses. We know that NIOSH is a component of OSHA that investigates thoroughly the line of duty deaths or the fatalities that happen in the fire service, but who's taking care of the injuries? Who's taking care of investigating the near misses? You know, is this the workman's comp side of insurance that does these things on the state, you know, each state level, or is this something that, you know, we need an additional component of? Number 10, grant programs should support the implementation of safe practices and or mandate safe practices as an eligibility requirement. So we know when we go to apply for grants, Homeland Security grants, so on and so forth, that there are requirements. Years ago, one of the first requirements was everybody had to have taken the online component of incident management system, the NIMS system, if you will, for 100 and 200 level. Everybody had to do that. You add in some of the other levels as we go along the timeline in order to be eligible. And certainly some of these programs are beginning to implement and use safe practices, mandating safe practices. Do you require training in these areas and have your employees trained in the areas of safety each year? Number 11 is the national standards for emergency response policies and procedures should be developed and championed. And so when the standards change and when things get upgraded, these are things that in the fire service we should champion and support wholeheartedly in order to reduce our level of injury and our level of fatalities. Number 12, national protocols for response to violent incidents should be developed and then championed. And over the past several years, we have initiated a lot more training in this area. Active shooter training has become something that most fire departments are doing on at least an annual basis now, if not more, and beginning to work with local law enforcement on a regular basis. Number 13, firefighters and their families must have access to counseling and psychological support. Our job is an inherently dangerous job, and this is something that oftentimes we accept when we take the job. However, there are things that firefighters, that paramedics and EMTs see on a daily basis that most normal people don't see. Most normal people don't have to mentally deal with some of the things that we see uh, about every time that we go on shift. And so we certainly need access to counseling and psychological counseling and support that doesn't break the bank. And a lot of cities are offering this uh, level of services at no charge. Number 14, public education must receive more resources and be championed as a critical fire and life safety program. Public education is something that typically we think of things that we do once a year at Fire Prevention Month in October, but this certainly is something that is ongoing throughout the year. There's from PSAs to educating the public on not only what we do, but on home safety, on safety in the business, from fire inspections, all on down the line. Number 15, advocacy must be strengthened for the enforcement of codes and the installation of home fire sprinklers. This is something here that the home fire sprinklers that is heavily talked about in the fire service, and we know that residential sprinkler systems greatly reduce fire damage, and ultimately civilian deaths, which is going to ultimately reduce in the reduction of firefighter line of duty deaths on scenes in those critical moments where we're engaging in rescue operations. And the last one, 16, safety must be a primary consideration in the design of apparatus and equipment. And I think this is something that we've seen on the forefront here in the past 10 years is better design of our fire apparatus, from seatbelt monitoring systems to rollover system and airbag systems that have been placed in our apparatus. And I think the industry does continue to support and do the research and spend the bucks on making our equipment much safer. We think back to when we just talk about equipment, we think back to the SCBA, where at some point the standard changed and it said that we had to have integrated pass devices because firefighters were just too darn stubborn to turn those things on. And so we took that out of the firefighters' hands, and when you charge your unit with air, boom, that pass device arms and comes on. The International Association of Fire Chiefs, or the IAFC, has sponsored and put out the Firefighter Safety Stand Down. And basically, this is a day-long stand down initiative that we do once a year, usually in the summertime in June, at that last part of June there. And the purpose of it is to focus on firefighter safety. We think about safety on those days that week, and we think about and we do classes on firefighter safety, and we take that moment to uh, focus on nothing but safety in that week. And again, that's the time that we talk about the 16 initiatives. We talk about the Everyone Goes Home program, and safety in general. All non-emergency work ceases, and the safety training sessions then are held. So this is kind of a time that the International Association of Fire Chiefs would have us to focus that week completely on safety and safety training. The next objective that we're going to talk about is we'll talk about the NFPA 1500, and it's related to the firefighter safety and health. So we know NFPA 1500 is the health and safety standard for the fire service, often termed as the OSHA standard for the fire service. Traditionally, accepted injury and illness and fatalities are a part of the job. We often state that we know and realize firefighting is an inherently dangerous job, and that firefighters accept this when we take the job. And even if you're volunteer and there's a point where you accept, yes, this job is dangerous and there's things that we're going to do that we are going to, there's going to be some risk to it. The fire service is progressing to be more safety conscious, and that certainly is our goal with these initiatives and with these programs. Firefighters understand that these incidents, deaths, injuries are all preventable and they can be avoided, right down to the little over 50% of the heart attacks and the cardiac related deaths that the fire service sees. Taking care of ourselves and using these initiatives are the big thing. Minimum requirements for a department's health and safety program. We'll go over a few of these real quick. Safety and health related policies and procedures. So we need those rules and regulations and those policies and procedures in writing and in force. The next is training and education, which I feel like we do very well. There's a lot of training and education out there, and a lot of departments keep up with their training. Most companies are training 1 to 2 hours each shift as far as career fire departments are concerned. And I know that a lot of volunteer fire departments out there are training once, twice, or even 3, 4 times a month. Some departments will do a meeting night on either Monday or Tuesday, if you will, for an example, and they're doing a 1 or 2 hour block of training as well as truck checks and equipment checks and that kind of thing. Fire apparatus, equipment, and driver operators, both training, experience, drivers training, and certification programs. These are certainly should be a part of the department's health and safety program. PPE and protective clothing, most definitely. This is one of them that most fire departments train on at least once a year, and that's putting on gear, putting on SCBAs for time, and practicing that and recording those skills. Emergency operations. This component of it, not only should we have in policy procedures in your command module for your SOPs for your department, emergency operations should certainly be there and broke down as far as safety is concerned as well. Safety of our fire stations and our facilities, from our administrative buildings to our training grounds and facilities to our fire stations, and all these things should be in our policies and procedures. And we talk about facility safety. One of the things that comes to mind, Lexington Fire Department here in Central Kentucky, I had trained with them as an instructor a lot on different things and in service and things over the years. And one of the rules is if you're on the training ground at Lexington, you have no less than gloves, helmet on at all times. Depending on what you're doing, you may have full PPE on, full bunker gear, bunker pants, but no matter what, you had gloves and you had headgear on, your helmet. Medical and physical requirements. This is something that departments across the United States are doing more and more now. And what we found that if we're doing regular medical and physical components once a year, we're catching a lot of things that ordinarily may not have been caught, from bad heart valves to diabetes to heart arrhythmias, that we have found by doing these physicals and doing these the blood work component along with the stress test. And so with that, a firefighter wellness program, definitely a very important component of your safety program within your fire department. And you can take this a whole lot of directions. Putting out initiatives for healthier eating and bringing in dietitians to train us in how to prepare food that is healthier for us. Just the cessation of smoking, that not using tobacco products. And when I say tobacco products, I mean vaping. I mean smoking cigarettes. I mean, those things. And it goes as deep as alcohol use, off-duty alcohol use. People drinking a lot when they're not on duty and trying to help themselves in other areas. Member assistant programs, the uh, the assistant programs that are available and out there that for not only mental health, or it could be a marriage counseling as well, could be available. It's a tough job that where we're home or we're away from our homes and our families a third of the time, working 24-hour shifts and being on 48. And we have to remember that, sometimes that can put stress on a marriage, especially if we're working additional overtime, if we have children, young children at home, where you have one parent that has to deal with, an entire 24-hour period without any help, those kind of things. And there's programs out there to help counseling with your marriage. And infection and exposure controls are other thing. These programs should be in place. A lot of places will mimic or parallel what the local hospital has in place, and those are the exposure protocols and programs that we're following. Taking a proactive approach to safety and health is this is something that we should and need to be thinking of on everything that we do in the fire service, from around the station to the training that we do to the approach that we take on active scenes. Safety should be one of those key things. Firefighter and departments must take a proactive approach at this. Fitness is in here. One of the things that we don't do enough of is fitness. You can encourage fitness. Some departments will have a mandatory annual test, physical fitness test, that if you don't pass, there's punitive, uh, there's punishment there that they can divvy out. I think it works best when it's non-punitive, when it's a participation based, and I think you get better results out of that. We have to look ahead for hazards, not only on the fire scene, but in the fire station when we're training and those things. And we need to be thinking the direction of overall health. Uh, and I think with the annual physicals in our wellness program, that we're catching a lot of health issues with blood work and those kind of things, falls on the side of health. NFPA 1500 requirements for a fire department training program. We want to prevent occupational illnesses and injuries, and ultimately we want to prevent those fatalities. Evaluations of skills and knowledge is important. That IFSAC testing requirements are important. Those annual classes that we do in gear drills and smoke reading and scene size up, all are geared ultimately back to our overall safety. New recruit training programs is something that we should take seriously, that should be very structured, and we should have very competent instructors that are delivering the material in these programs. And again, in each component of these programs, we need to be focusing on safety and the prevention of illness, injury, and fatalities. Methods for becoming proficient in our firefighter duties. Experience does go a long way, but at some point, consistent training. And I'm not talking about sitting around a tabletop doing a discussion and penciling in an hour or two of training. I'm talking about you do those things and then you go out and you practice the associated skills that go along with those topics where they're applicable. Personnel may not be assigned until they complete required evaluations and trainings. It's a good idea to have these policies in place. Your recruit program, they need to meet certain benchmarks along the way and to complete their training and to complete their evaluations before we put them on the crews. And there's certainly going to be additional training and additional on the job training tips and tricks that they're going to earn and learn there when they hit the crews, when they hit the streets working. We must meet the requirements of the NFPA 1000 series. This is your professional qualification standards at each level. Thorough documentation. This is one of the primary jobs of a company officer, is that documentation of injuries, that first report of injury for workman's comp. The exposure reports when we have an occupational exposure. An annual proficiency training and program. This is where we take some of those skills and we do them each year in our training programs and in our in-service type training. And this could be anywhere from the scene size up, the gear drills, the PPE training, the smoke reading, all the way up to ladder drills and vent inner search. These are things that we got to be proficient at. In order to do that, we need to practice this in training and document that. Document those proficiencies. Fill out the training records, fill out those JPRs or those skill sheets, and turn them in. That's your provability that you've met the standard, that you're meeting the standard. Training for updated policies and procedures. Anytime that we update procedure and policy, then we should roll out training. And you can roll out training in a lot of different venues, a lot of different ways that you can do that. Training in conditions close to the actual emergencies. Although we do have to keep our training as safe as possible, but we also need to keep our training as real as we possibly can in the safest way that we can. Safety during our training evolutions, use the appropriate PPE. If it is an evolution that requires full PPE, breathing air with an SCBA, and that's how we would really approach it, then that's what we need to do. Maintain your situational awareness just like we do when we're on scene. Be aware of your physical condition. Be aware of your limitations. How you feel that day might dictate, how things are going that day. The key here is be in good physical condition. And yes, for us that means eating right. That means exercising on a regular basis. Adhering to all safety regulations. If you're working around charged hose lines, make sure you got your helmet and gloves on. Make sure you're wearing your PPE appropriately for the situations. Adhere to all the safety regulations and maintain PPE and the training equipment in good working order. Safety apparatus, for apparatus and driver operators. Your apparatus should have seat belts for all occupants. They should be in working order. Maintenance and inventory records maintained for all of your equipment. This is one of the things it's pretty important. And we talk about who can work on equipment, and especially apparatus. Do they need to be certified and all these things? And certainly we need folks that are working on our trucks that are experienced in that kind of work, that know how to repair fire apparatus and the equipment. Driver operators, again, wear your seat belt. I'm not sure why this has to be on here, but it's on here because people aren't doing it. The reason why that they color seatbelt red in fire apparatus is so others outside can see if it's being worn going down the road. And it's to remind you, hey, you need to put this sucker on. Obey your traffic signals and your regulations. Yes, most state laws will exempt us from traffic lights and things like that. But what we have to realize is when we're responding, even though we're allowed to go faster than the speed limit, run through red lights and that kind of thing, you have to do these things with due regard of everyone else. If that means stopping in every intersection, then proceeding, then that's what we got to do. Be thoroughly trained before operating apparatus in emergencies. Everything about that apparatus you should know. How to drive it, how to operate it, how to operate the pump. If it has a pump, how to operate the equipment with it, whatever equipment it may have, from generators, so on and so forth. Know that piece of equipment. Don't be on a fire scene when things really matter and not know how to work the equipment. PPE and SCBA requirements. Uh, Personnel in an immediately dangerous to life and health type atmosphere or hazardous areas must be fully equipped in their PPE and SCBAs. Departments must provide all members with appropriate protective clothing and equipment. Sometimes this is a challenge for our volunteer fire departments, but even so, we've got to be able to meet that standard. Protective clothing must comply with the appropriate NFPA design standards. Incident management system and the incident command system must include risk management plan and a personal accountability system. Your emergency operations must include rapid intervention crews, rehab setup, and some type of post-incident analysis. We think about RIC crews often. We've trained about them over the years pretty heavily, and this is something that we got to put in place. We got to put our accountability in place, and it all starts with the incident command system. When you implement your IMS and you put accountability forward, you're going to think about the risk. You're going to think about the rapid intervention crews. You're going to think about setting up the rehab. And then ultimately, when we're done with the call for the day, at some point, we'll look at the things that went right. We'll look at the things that went wrong, and we'll talk about how to improve things. Minimum requirements for fire department facilities. We talk about fire stations and administrative building, the minimum requirements. This also goes to apparatus and apparatus maintenance all the way down to the training center, training buildings, and the training grounds. A big one here with 1500 is the medical and physical requirements. Medical evaluations to ensure candidates can perform duties. Physical performance standards for hiring, and these may continue on throughout your service. A designated physician who is available to take care of the department's needs for their wellness and their checkups. Job-related physical fitness standards. There may be standards, there may be certain tests or certain tasks that we're required to perform on an annual basis to prove our physical fitness. And having a fitness program in place, whether that be voluntary, whether that be a set standard. And then annual medical exams, where we go through each year the process of our physicals, our blood work, talking to a physician, those kind of things. That's where we're catching a lot of the health problems. Documentation of on-the-job injuries and exposures. You've got to do good documentation. You have to fill out these reports accurately, fully, and correctly. When it comes to workman's comp, they're going on the information that you're giving. You're detailing and you're painting a picture of what happened in your words and in your documentation. And anytime that we do an exposure, you need to do that first report of injury as well. Think of an exposure as an injury as well, because it can potentially be that. Your infection control program should outline infection control officer. It should have, again, the documentation, the process for having blood drawn, and certain tests done in certain situations, whether that be through a clinic or a hospital, whoever that may be. And again, it's going to outline who's in charge of that program. Remember that medical records are kept confidential. These are documents that gets turned into command staff, and then ultimately it heads to administration. It shouldn't be left laying around. These are documents that are nobody else's concern. And so this information is not just to be left laying around. Prohibits firefighters from operating while under the influence of alcohol or drugs. And a lot of departments today have pretty strict drug testing policies in place. A lot of folks, a lot of departments out there have a no tolerance or a zero tolerance policy where if they randomly test you and you test positive for um, a substance, whether it be illegal or on the list, then they're going to terminate you. Our next objective, is describe fire department programs intended to reduce firefighter illness, injuries, and fatalities. We start with wellness programs which we've been talking about. These programs and initiatives helps guide firefighters towards a healthier lifestyle and to maintain fitness for duty. We want to be fit for duty. And ultimately, this is going to reduce illnesses, injuries, and fatalities. Guidelines for maintaining personal health. Adopt safe behaviors and healthy lifestyle. Maintain good nutrition. This is something that is on us. To not only eat well while we're on duty, but to eat well away from the station and when we're at home. Stay informed about job-related health issues. Recently, in the past 10 years or so, cancer in the fire service has become a hot topic, and it's something that we're training regularly our firefighters on, is how to reduce our exposures across the board. Wear the appropriate PPE, whether we're dealing with EMS calls or whether we're dealing with firefighting calls. Wear the appropriate PPE. Clean PPE at least twice a year and after every exposure to smoke. It's not just getting it nasty. If you expose it to smoke, there's unburnt particles. Remember, smoke is unburnt particles of combustion that settles on your gear and it needs to be cleaned off. Follow the recommendations for vaccinations. Use precautions to avoid airborne and bloodborne pathogens, from wearing our HEPA masks to gloves, gowns, and those kind of things on EMS type calls or anywhere that we might be exposed to those type of pathogens. Use proper lifting techniques. Remember, lift with your legs, not your back. Squat down, keep your back straight. We practice this when we do ladder lifts, when we lift equipment from generators, etc. That this is something that we should be doing across the board. Use lifting tools or get help lifting heavy objects. You can't lift it by yourself, whether it be a 2 firefighter, 3 firefighter carry or lift, then recruit the help that you need. Maintain a regular exercise program. More and more firefighters are buying into this today, and it is something that we need to encourage. I remember first entering the fire service, there wasn't a big health initiative or wellness initiative when it came to exercise programs, and we were lucky at best to get people into the gym. And at that time, a lot of firefighters smoked cigarettes on a regular basis, and it wasn't uncommon to walk into a firehouse and there'd be ashtrays and the smell of cigarette smoke that hung around the air. We want to clean, disinfect, and properly store patient care tools and equipment. So if we're running EMS type calls and the equipment that we're using that's not disposable needs to be cared for and cleaned and maintained. Maintain a diet low in cholesterol, fat, and sodium. We know that sodium raises the blood pressure. We know that cholesterol and high things or foods that are high in saturated fats cause cardiovascular disease. Something else that's noteworthy here is the energy drinks. And we've all partake in an energy drink. I think firefighters in general feel like they need to push through because we are busy at times and we do have a lot of calls, and sometimes we don't get a lot of sleep on shift. So we feel like we need to push through, and one thing to do that is sugar and caffeine. And then we add in that nicotine. And what this does is constricts our vessels and causes a higher blood pressure, if you will, and overall the health effects of that are pretty negative. Maintain your blood pressure and your cholesterol levels. One of the reasons why we do our annual health and wellness is to gather up the blood work and to see how we're doing in these areas. And then again, completely eliminate the use of tobacco products, including vaping. Some of our health-related problems. Wellness programs should offer counseling in the way of nutrition, which we've kind of talked about and hit on. Weight control, healthy ways to lose weight and get it a healthy weight. High blood pressure or hypertension is something, again, if you got to be on medicine, you got to be on medicine. Sometimes high blood pressure is simply hereditary. It's in your genes and your genetic pool, and you cannot, that's something that you can't change and eliminate. So it may be necessary to take a medication for it. And then physical conditioning, which is something that we do have control of. Exercise and diet. Prevention of injury should be on our minds all the time. One of the ways that we do this is effective training. Training on the fire ground. Actually, not just talking about what we're doing, but practicing those skills on a training ground. Maintain company discipline and accountability. We stay together, fight fire together, we do things together, and we don't separate. Maintain your accountability on fire scenes especially. Follow safety-related SOPs. Use your PPE. Many situations of line of duty deaths, when we look at these NIOSH reports, we see that PPE not being used. Things as simple as hoods and gloves not being used ultimately contributed to the final disposition of the call. High levels of physical fitness, again, we got to stay in shape. Follow risk management guidelines. Use rehab facilities and incidents. We're getting to the point now where we're going to have firefighters completely geared down. That's come out of your pants and boots, the whole 9 yards. Sit down, rehydrate with water. Blood pressure's taken. You're not going to be allowed to re-enter until your blood pressure has come down. Illness can cause lost duty time, whether that be chronic or acute illnesses. You know, some things during something as simple as during flu season, a regular disinfecting and cleaning of the fire stations, a regular washing all dishes, plates, silverware, cups, coffee mugs in the high temp dishwasher. Those all go a long way to reducing, lost duty time, and ultimately, does less damage to the budget. Chronic illnesses, are we deconning ourselves? Are we preventing the cancers and the lung problems by wearing the appropriate PPE, cleaning the appropriate times, post fire, even when we just get smoke on it, at least twice a year as well. Cardiovascular disease, work-related causes, exposure to the smoke and the chemicals, just the heat stress, which is probably the big thing. The biggest thing is your stress and your heat stress, psychological stress in there too, and long irregular work hours. I know that a lot of fire chiefs, older fire chiefs that I've served under, was very adamant that we worked from 8 to 5 or 8 to 6 and we did not take naps and that kind of thing. And I'm a proponent of, if you've got your duties done for the day and it's 2 o'clock in the afternoon and we've trained and we've got everything completely finished, chores are done, stations clean, then it's okay to rest. Non-job related causes of cardiovascular disease, obesity, the use of tobacco, which we've seen a pretty big decline across the board. And the big thing is lack of physical fitness. We've got to get firefighters training, physical training. We've got to get them moving and reducing these cardiovascular incidents. In prevention, we adhere to the policies and procedures. Wear your PPE. It's been on here several times now. Reduce your exposure to hazards. Wear your mask. Wear your hood. Keep your mask on during overhaul until it's completed. Healthy diet. Don't use tobacco. And again, exercise on a regular basis. Respiratory disease. Common respiratory diseases we know as asthma, lung cancer, and chronic pulmonary obstructive disease. Prevention is wear the proper respiratory equipment and follow your department procedures. Wear your PPE. Most often for us, this comes into play when the fire's out, we've taken a break, and now it's time to work. We're going to do overhaul. We're going to put out hidden fires. We're going to pull away walls to make sure we've got everything out, and we're going to salvage what we can. And it's just uncomfortable to keep wearing that. What you got to realize is things are still off-gassing. There's still carbon monoxide and hydrogen cyanide in the air. And these are all things that you're absorbing and inhaling. No smoking. Try to maintain a healthy lifestyle as well. Carcinogens at fire scenes, toxic gas, vapor, particulates contaminate your protective gear. The risk of dermal contamination and inhalation injury is there. That's why we want you deconning at the scene. That's why we want people wiping neck, face, and ears, hands at the fire scene. Be careful about drinking liquids before you've decontaminated, putting hands to the face and mouth. Modern fires have more contaminants and products that burn at higher temperatures. Higher temperatures then increase skin's absorption rate by quite a bit. And so we get heated up, you need to get cooled down, rehab, and rehydrate. Looking at the cancer risk, we know firefighters are at increased risk for cancer overall, and this kind of spells it out. Your melanoma skin cancer, goes up to 1.5 or 1.5 times as much as the normal person. Colon cancer is 1.2. Testicular cancer is twice as high, and prostate cancer is nearly 1.3. And the reason is because of when we're wearing our gear, your sweat kind of collects all in the groin. This is why it's imperative that we shower, that we take a near cold shower when we get back to the station. I know that sounds completely awful, but it's important because hot water opens the pores and raises the absorption rate of the skin. The cooler water keeps it closed up. You get the nasty stuff off. Once you've rinsed off, then you can warm your water up. How to prevent and limit chemical exposures. Always wear your SCBA working in and around damaged structures. And again, I can't reiterate enough, wear your SCBA during salvage and overhaul until we're done. Remain upwind of fires and smoke. If we're standing outside and you're not clipped in, don't stand around and breathe the smoke. Get away from it. Doff contaminated gear before we enter the rehab area. This is something that's coming about recently that we're going to start practicing on a regular basis. Getting your gear off, wiping your face and hands before you enter your rehab areas. Do not wear or store contaminated turnout gear inside the apparatus cab, personal vehicles, or station or home living areas. Bag it get it off, doff it, bag it. We'll return. That way you have to decon less of the cabin of your apparatus and clean it when we get back. Spray the big stuff off on the scene, and at some point we need to wash it when we get back. Decontaminate your equipment that contacts the skin after each response. Don't leave pike pole handles dirty. Don't leave hoods dirty. That's why we are exchanging hoods now, and we are washing hoods and getting firefighters clean hoods at the scene. Wash your hands and neck and skin after fire and shower as soon as possible, okay? Wellness programs that are combating obesity. We encourage, again, a healthy diet and exercise programs and habits. The programs problems rather caused by obesity is the additional strain on the body and the stress. When we add on the extra weight, it's harder to perform our duties. It's harder to wear our gear around. You got to think you're wearing almost 75 pounds of gear. All right, 75 pounds of gear, walking around in it by OSHA standard is considered heavy work. Then we add in throwing ladders, using a chainsaw, cutting a vent hose, pulling hose line, spraying water and putting out fire. So we're doing a lot of heavy work. Higher risk of type 2 diabetes. It puts you at higher risk of cardiovascular disease, higher risk of stroke, higher risk of high blood pressure, and even higher risk of some forms of cancer. Acute chronic health consequence from exposure to various substances. Infectious diseases, which we do train on heavily. We train on this once a year. I think a lot of times we don't think about products of combustions and chemicals that are in there as much, but we need to. Engine exhaust. Don't stand around the exhaust pipe of operating apparatus and breathe that exhaust. Get away from it if you can. Other environmental exposures that are out there. These a lot of plastics and a lot of plastic products. They burn hotter. They put off some pretty nasty smoke. And that again, those particles, we don't want them on our skin. We don't want them on our gear. If we do get it on us, clean it off as soon as possible. Infection exposure control programs. We want to limit our exposures. You could do so by wearing the proper PPE. That includes face masks and face shields. Eye protection seems to be one of the number one things in EMS that we forget across the board. Documented exposures. Use the exposure program. Document these exposures. These records are maintained for many years. If anything happens, we can go back and possibly correlate something to that if we need to. And then provide the access to the treatment through the program. Precaution against exposures when we treat medical patients. This is something that we're pretty familiar with at this point. We've been dealing with and talking about the COVID-19 coronavirus. And so we're familiar with gowns and gloves and masks and this type of equipment. We want to limit unnecessary physical contact. It may be a situations that, like we're doing, we only have one person don PPE. We keep one person clean in the cab of the truck. If we need help, we need help. Everybody dresses out. Maintain the recommended distance of separation. Right now for us, it's 6 feet or more. Wear appropriate PPE again and use BSI methods for all patients, which we do. Employee health or employee assistant programs provide accessible confidential assistance that can affect job performance. Some of these things are anything, tobacco use, substance abuse, or alcohol use is one of the big ones. Could be personal problems that are related to stress. Marital problems often comes from the stress and stress of having financial problems. All of these things listed here, employee assistance programs can help you deal with. Drugs and alcohol, we know, can impair your ability to function. It can slow your reaction time. Most departments prohibit firefighters from responding while under the influence. All should prohibit this. I'm not sure why most departments are on this slide. Some departments prohibit candidates from using alcohol, period, while they're in a recruit program. Certainly a good idea. You are responsible for controlling use of drugs and alcohol while on call and prior to duty. It's a personal responsibility. A lot of people say, well, alcohol's not illegal. No, it's not. But do you drink 1 hour before you report to duty? Or do you separate that at least 8 to 10 hours, after you've had a beer or after you've had a glass of wine? You must not respond to a call or report to the station if under the influence or if taking medication that causes impairment. In some places, or in most places, this would be grounds for dismissal. Next, we'll talk about tobacco use. If you do not use tobacco, please don't start. Nicotine is a very addictive drug. It's very hard to quit once you've started vaping or smoking. If you do, take advantage of the programs that are in place to help you stop. There's a lot of programs out there. There's doctors that are willing to help you. Health insurance will even pay for that one-time cessation. Dealing with stress, stress that relates directly to our occupation. Stay in good physical condition. Keep positive mental focus and attitude. Relax when possible. And again, I reiterate, if everything's done at the station, I'm a proponent of go ahead and rest. Take a nap. Personal stress management programs that are out there to take advantage of, and member assistance programs. Warning signs and symptoms of stress, uh, memory problems, forgetting things, somebody who had really good judgment, just poor judgment, anxious thoughts, constant worrying. These could be some things on the cognitive side that can be signs of, symptoms of it. Moodiness, as far as emotionally is concerned, feeling lonely, isolated, isolating yourself away from everybody else, even down to depression or just general unhappiness. Physical symptoms could be nausea, diarrhea, muscle tensions, cramps and spasms, butterflies in the stomach or indigestion, uh, and holding your breath, clenching your teeth, grinding your teeth. All of these things could be physical symptoms. Behavioral symptoms could be eating more when you're not really hungry, sleeping too much or too little, procrastinating or neglecting responsibilities, forgetting about responsibilities, being easily confused or flustered, lack of sense of humor, and general feeling of being upset. All of these can be signs, warning signs of stress. Atypical stress, critical incident stress debriefing, is not as effective as once thought. Officers and supervisors should monitor personnel for the signs of post-traumatic stress disorder and recommend assistance from specialists. So this is where we recommend um, the employee assistance programs that directly deal with PTSD, as well as, it's good to call CISD programs in, but chances are that we don't do the round the table talks anymore. We do meet and they do talk about the do's and the don'ts like we just talked about in this slide presentation. And then they offer up their assistance for counseling. If you want to talk to one of them privately, they offer up that assist. They'll stay and they'll talk to you. There's no obligation to talk out loud anymore during these programs.